Vivien, it's such a pleasure to be here at the second annual COMI meeting in Paris, and it's particularly an honor, actually, to be with you as my patient and friend who is from France and lives in Paris, but visits us at Dana-Farber in Boston. Yeah. You've been at the meeting for the last 2 days. And perhaps, Vivien, we could just start for our viewers by sharing your story from your journey with myeloma.
So I'm turning 42 in exactly 1 month. I've had myeloma diagnosed with myeloma for 13 years now. I basically found out, through mechanical ways, my nerve was pinched by a tumor in a cervical, and so my arm was going crazy, and so I basically started from scratch trying to find out what I had. And it was basically a plasmacytoma. So I was very lucky because it started very isolated, as you know, and it grew into a regular. Nothing is regular in my myeloma, but a more common myeloma form. And so what is quite interesting about the way my myeloma progressed is that it basically progressed in a very scalar manner, i.e. starting from plasmacytoma and going into 2 tumors when I relapsed, and then basically was like a full-blown myeloma right after that. I first had like a surgery when there was a plasmacytoma, and then radiotherapy, and then when it relapsed 6 years afterwards in 2 spots, including one that was extramedullary. I had radiotherapy and chemo.
And if you want to just tell us a little bit, Vivien, because obviously you've been, since your diagnosis 13 years ago, you've done incredibly well. You've worked full-time, you're highly productive, you're a father, you're a family man. You're doing a lot, not just in terms of your own family, but in terms of other people. You're incredibly generous and philanthropic. But backing up a little bit, if I may, in terms of your treatment, it wasn't really chemotherapy, was it? You had some radiation, you had some bone strengthening medicine, and then your initial treatment was Bortezomib.
Yes. I mean, so initially just, surgery by Professor Saillant, who removed the vertebra, and then radiotherapy from Cosset at Curie, and then I had some, indeed, Zometa to just strengthen the bones. Second time it was mostly radiotherapy with Curie again, and Cosset, and then I had some Velcade at the time. And Dex.
We call that, biological therapy, because Bortezomib as a proteasome inhibitor targets the bone, so it was rational to use it because it was going for your bone-based disease. The steroids obviously are a mainstay, bit of a nuisance, aren't they? They're a double-edged sword, but you did very well with them. And the zoledronic acid, or Zometa, very interesting, because we now know it's a bit more than a bone strengthener. We know that it also has immunooncologic properties. It activates gamma T cells, and it helps your immune system fight your disease.
That's right, which was interesting because the second time, since it was a bit extramedullary, right under my supraclavicular on the right side, it proved to be that, because Velcade was only for the bones, and it was not entirely in the bones then. So indeed, it proved to be something else. So I guess we learned a lot. I mean, you learn a lot as you basically discover the effects on different people of these drugs. And then the third time, indeed, when I relapsed 2 years ago, then I did the full-blown, chemotherapy, RVD. So used revlimid, and then I did a stem cell transplant that I collected myself, 3 years ago. So when I first relapsed. And used them last year.
That's very interesting, Vivien, if I may, for our viewers, because again, there is a debate about the timing of stem cell transplant, and the treatment that you had to get you into remission to prepare you for the stem cell was the revlimid, the Velcade, and the Dex. We call this RVD. It's a regimen that is, again, biological. Synergy between the immunomodulation of the revlimid and some of its effects on various other pathways that matter in myeloma, and Bortezomib as a proteasome inhibitor. But very interestingly, you stored your stem cells initially, and you kept them for how many years before you did the stem cell transplant?
At least 3 years, yes. Which is very funny because, as you mentioned, before I started revlimid, as you know, you can't have kids when you start revlimid anymore. And so I decided to have a son before that. And when my son was born in France, I tried to collect the stem cells, but in France,
the cord cells.
yes, and in France, they basically prevent that from they prevent you from doing it, because the French social security system then would have to pay for it for everyone. You cannot basically pay for it for yourself, which it doesn't make sense, especially for people in my case where by nature you need stem cells and you're so sensitive to stem cells and you know how important they are. And so I fought for it, and I collected them, and I basically fought legally to make sure that everybody would be safe, and that try to change the law. So we won that. But stem cells is definitely very important, and I was lucky to be able to collect my own, but I was already sick. So they let you do that in France, but they don't let you collect them when you're not sick, which is typical of the French system.
Well, it's very interesting because in the US you can easily collect and store cells.
Yeah.
Also, we are very comfortable collecting cord blood in order to store for the future. Now, I recognize you really championed not just for yourself but for others in the future on this issue, and that again, Vivien, is something that you've embraced, and I say on our behalf as researchers in the field, it is people like you who make the difference, because at the end of the day, your passion and your philanthropy and your looking to the bigger picture has been something remarkable.